My name is Gina del Peso. My topic is by science for dietary supplementation to improving cancer and heart disease. Definition. These products are heavily marketed for many heart people, believed claims that they could help prevent heart disease and cancer. There have already been many studies on disease claims, and research shows that most people do not benefit from taking supplements, and some supplements may be harmful for some. Application in nursing. As nurses, we must educate patients and teach them that it is not just clean water taken. Vitamins can reduce the risk of heart disease or heart attack. But what is known is that there is no vitamin that can prevent the development of heart disease if other risk factors are not controlled, such as having a poor diet, smoking, having high cholesterol, and diabetes. Video.
One of the most common questions I get from patients are, what are some supplements I can take for cardiac protection? Now, vitamins are extremely common. Most people take vitamins, but really the data for vitamins is extremely poor, especially for cardiac health. So there's been studies looking at vitamin C and vitamin E, and they're actually not beneficial at all. In fact, there's been a study looking at vitamin E supplementation, and it actually may lead to more heart failure and stroke. So we actually actively discourage our cardiac patients from taking vitamin E. Now, vitamin C probably doesn't do anything for the heart. So we tell them, if you want to take it for common cold, you can, but for heart protection, really there is no benefit. And most people think that maybe multivitamins helpful. Actually, it's actually no benefit for cardiac protection. There has never been a vitamin that actually helps protect heart. Now, some people say, what about vitamin D? The data on vitamin D is extremely sketchy. Now, if your vitamin D level's very, very low, there might be benefit to supplementing vitamin D. But for the rest of us, the data is not very good. So for right now, we're going to wait for the trials for vitamin D, but really there's no data to support routine use of any of these vitamins for cardiac protection. Now, there are some over-the-counter vitamins that can definitely be harmful. And we really want you to talk to your doctor before you take any supplemental vitamins. There's been some vitamins that increase heart rates because they're made out of animal thyroid. Some of them actually increase heart rate and blood pressure. So we're very careful to tell our patients, especially our heart disease patients who are on antihypertensive medicine, to please speak to us before they take anything. There's also over-the-counter cholesterol-lowering medicine. Some of them actually have had multiple FDA warning letters about causing liver damage. There are vitamins that can definitely interfere with your cardiac medicine. So there are vitamins that can increase your bleeding time, for example, cause increase in your heart rate and in your blood pressure. And that can actually lower the efficacy of some of the medicines you're taking. So it's really important to talk to your doctor about the vitamins, because some of them can definitely interact with your cardiac medications, making them less beneficial or maybe increasing or potentiating the effect. We worry most about bleeding complications. So there are patients with AFib who are on Coumadin or on newer anticoagulant agent, and then they get started on a supplement, and their bleeding time greatly increases, and they come in with, profound bleeding events. So before you start any supplements, good idea to talk to your doctor about whether these supplements can harm or benefit you.
Pros. For cancer, they had not been shown to help, however, some people may need supplements. Women who could become pregnant should take folic acid supplements. Some people, especially after age 65, may need a vitamin D supplement. Breastfeeders may need additional vitamins B12. Cons. Research shows that vitamins and beta-carotene supplements do not help prevent cancer or heart disease. Multivitamins do not help prevent cancer or heart disease. Studies show that beta-carotene may increase the risk of lung cancer in smokers and in people who have been exposed to asbestos. And another studies show that vitamin I could increase the risk of prostate cancer. Video.
Hi everyone, today in this video I'm going to show you how to prevent cancer. One of the study or many studies have so many evidence about using vitamin C to prevent the risk of getting most types of cancer. And these studies in most case control studies have found that an inverse association between dietary vitamin C intake and cancer of the lung, breast, colon or rectum, and etc. So it means that a routine vitamin C intake for you can help you to prevent cancer. So I highly recommend you to take one of these vitamin C products, such as this nature-made vitamin C 1000 milligrams in each tablet. You can have it from Amazon.com. The link is under this video. This dietary supplement I highly recommend you to take because it has a great dose, high dose of vitamin C for 1000 milligrams, and it has a great rating in it, 4.7 out of 5. It means that many people like it, and you can have it in Amazon for only $18.99 for 100 tablets in each bottle of it. If you want to read more of the description of this dietary supplement, you can check the link under this video. Maybe that's all I can say. Thank you.
Issue apply in Ecuador. In Ecuador, the risk of developing cancer before the age of 75 is 20%. For this, the ministry have developed multiple strategies to contact it and detect it in the earliest stages. For heart disease, it is more common, but programs are not developed to treat these diseases with nutritional supplements. Conclusion. Improving knowledge and the application of effective and efficient cancer control programs has been shown to reduce the burden of cancer and improve the quality of life for cancer patients and their families. However, the use of nutritional supplement does not comply in improving in these patients. Thank you.